Hi, my name is Mark Fritzy. I'm a retired physician who was in private practice in radiology for 35 years. I went to medical school in the early 1980s, and I would like to share a story of a patient I encountered in 1983 as a third year medical student. If you ask any physician if they remember any patients they encountered during medical school, most of them would probably tell you they do remember at least one. One patient I will never forget arrived while I was on call with the pediatric team at a large children's hospital. About 11 o'clock at night, my beeper went off, and the intern who was on the team told me they had a young child being medi-flighted in from a small town who they think had meningitis. He was assigned to me to be a patient on the team. It turns out that this child had a severe case of Haemophilus influenza type B meningitis, otherwise known as H. flu meningitis. Some strains of this bacteria are aggressively invasive and can trigger a sudden catastrophic outcome. I will never forget being in the ICU and listening to the head of the pediatric team explain to the sobbing parents that their intubated, unresponsive young child was brain dead. Just 3 days before, this child was normal and healthy. There was no H flu vaccine in 1983. The Hib vaccine arrived in the US in 1985, and in the years that followed, widespread use drove H flu meningitis rates down 90 to 99% to the point of near elimination in well immunized populations. It also drove down rates of Haemophilus influenza epiglottitis, which is a swelling in the throat which can cause airway obstruction and brain anoxia and death. It seems that the vaccines which we are using today are a victim of their own success. They have eliminated or nearly eliminated many of these childhood diseases and thus have erased from public memory the horror of the morbidity and mortality of these diseases. It is a biological certainty that these vaccine preventable diseases will come back if the immunization rates drop low enough. I think many grandparents and great grandparents have a unique perspective about vaccine preventable disease. In addition to providing today's parents with complete and accurate data regarding the safety and efficacy of childhood vaccination, these perspectives need to be heard. Thanks for listening.